Let's talk about this. A 6-week-old means 1.5 month old male presents with lethargy, hypotonia, failure to thrive, and delayed milestone development. On physical exam, he is jaundiced and has a large protruding tongue. Okay. On blood investigation, the baby has low thyroid hormone. The baby might have an NADH enzyme deficiency. Which of the following may be deficient in this condition? So what is the enzyme that is absent, that is present in thyroid gland and required for synthesis of thyroid hormone? And this is basically DuOX oxidase. This is nothing but an ADPX oxidase specific to NADPH oxidase specific to thyroid gland. Okay, this is specific to thyroid gland. So what does this do? This NADPH oxidase, actually this is iodide ion, this NADPH oxygen, it will actually oxidize this iodine to iodinium, negative charge to positive charge, I plus, and this I plus is very selectively attack the ring here. So because this ring, I will write here ring. Okay, this is a ring that is present in tyrosine. Tyrosine has OH group here, and this is attached to protein chain here. Okay, so this ring, it will attach selectively to this ring automatically. So first function of this NADPH to production of I plus, and second function is organification. Organification is attachment of iodine here. Iodine always, because of this iodine always attached to this side adjacent to this hydroxyl group. There is a biochemical region, chemical region. So I'm not going to talk about this chemical region. Just understand it will attach to either side of this hydroxyl group or the side of here. Okay, so mainly it will attach here or here. So understand this, it will attach here and here first by the side of OH group. Because of this I plus, it will attack here and attach here. So this is done by this NADH oxidase. NADH oxidase first ionize this iodine and then help iodine to attach this ring of tyrosine. And this is protein is thyroglobin protein. So remember at least this step, you will study this thyroid hormone synthesis in next class. If you correlate this information there, it will be very helpful to you, because I don't think this Dr. Dev will talk you in this detail, because it is not necessary for him to talk in this detail. I only told you because this is the actually part of our course. So this is called dual oxidase. So it will do two functions. So this is dual oxidase, and in short term it is called DuOX. In short form, it is called DuOX, dual oxidase. This is nothing but NADPH, specific type of NADPH oxidase that is present in thyroid gland. So did you all understand about this DuOX oxidase?
Yes, sir.
Okay. If you have understood, you can say this is the patient. You can see protruding tongue here, and you can see delayed milestone development. If thyroid hormone is not synthesized, you can see the patient with low thyroid hormone is called cretinism. So you can see in such patient protruding tongue, delayed growth, mental development is also delayed. Everything is delayed because of low thyroid hormone, thyroxine. Everything is there, and this is called congenital hypothyroidism, and that happens because of this enzyme. Very rare. Okay, very rare. I think this may not ask you in USMLE or NBME. This is not that important, but if you understand this disorder, you will understand the synthesis of thyroid hormone very nicely. You can correlate the synthesis of thyroid hormone with this very important enzyme. This is a very peculiar step. This is most important step in the synthesis of thyroid hormone, DuOX enzyme. That is why, in order to focus on this, I had to take help of this disorder. Okay, so DuOX. So you can see here DuOX enzyme is there. So this is present. This is actually thyroid follicle. Thyroid follicle is like this. So there will be columnar epithelium cell here. Okay. So columnar, here is thyroglobulin inside this follicle. And then in this thyroglobulin, there is tyrosine residue like this. Many tyrosine residue will be there in this. Many tyrosine residue will be there. And this tyrosine residue here, you can see on the epithelium. Enzyme is always, this NADPase oxidase, I told you, it is present always attached with the membrane. So it is attached with the membrane, and this it will DuOX. What will it do? It will actually change this iodine into I plus. Okay, because of generation of free radical, and this I plus will easily attack this ring. This ring, you can see fine ring here inside the, this is thyroglobulin, will attach, and then it will form thyroxine hormone. Okay, so this is a very most important step in the synthesis of thyroxine hormone. And if this enzyme is deficient, it will cause, in baby, it will cause thyroid hormone deficiency, hypothyroidism. Okay, hypothyroidism. So focus on this enzyme. This is a very important part of thyroid hormone synthesis.